The only time we can do this at our practice is if at all the person is not a good candidate for an implant for whatever reason, and this is what would work best for them. The bridge will be cemented. And we're back. So we've talked about cavities that form on your enamel or on your dentine, or even cavities that get into your root canal system. And we've talked about what needs to be done at every stage, whether it's a filling, a deep filling, or a root canal filling. However, if a root canal filling is done, that's not the end of the story. The tooth requires something called a crown. So a crown looks like this. So it's part of your tooth that we trim off, and then we place a cap on top of it. So the cap is made of a material that's evenly cured inside a lab. So it can be made of precious metal, it can be made of pure metal, it can be made of porcelain or porcelain fused to metal, or these days there's a good material called zirconium that looks very lustrous and lifelike, looks like your real tooth, and it's very light. So that's a type of a crown that we can use. So any tooth that has been root treated, I know you'll be free of pain and you'll be happy that you can sleep well, you can eat with it, you're not getting any pain, there are no swellings, but that's not the end of the road. You need to have your crown done. Otherwise, if you don't have your crown done on the tooth, then it can easily split because of the weight that is landing on top of the weak roots. So when you do a root canal filling, the tooth gets to be dehydrated. Now it's no longer getting water, it's no longer getting blood supply, there's no oxygen inside there, so it's pretty dull. It's almost like a tomb. It's empty and it's dry on the inside, so it can break easily when you eat food. So the best thing to have on your tooth after root canal filling done is a crown, so that you can extend the life of that tooth. So let's say perhaps you've gone all the way. I mean, you're super resilient. You've had a cavity, it got sensitive, it got pain, you got a swelling. I mean, all this time you're not getting, warnings like, let me go to the dentist. And you come to the dentist and the tooth is badly gone. So we only have the option of taking the tooth out. At that point, we will take the tooth out, but it doesn't end there. Once we remove the tooth, we need to think about a replacement, because if we don't have a replacement done, this is what happens. The tooth on the opposite side somewhat gets longer. It's not growing longer or taller. The thing is, it's trying to oppose the tooth that's missing. So it's looking for something to bite against, because teeth knock each other like that. So if it doesn't get anything to bite with, guess what? It just keeps getting longer and longer, to the point where it probably has to be taken out, even if it's a healthy tooth, just because of its position. So when you have your tooth taken out, unfortunately, if you've been that resilient, so if you have your tooth taken out, please make sure that the tooth is replaced. There's nothing as bad as having a missing tooth on one side and then you're having your opposite tooth getting taller and taller. So have your teeth replaced. So different techniques of replacing your missing tooth in case you've lost it. So like this tooth here that's gone missing, we have different methods of doing the replacement. We can have a removable option, which means there's something that you put inside your mouth and take it out probably at the end of the day, or you take it out when you're cleaning. So that replacement would look something like this. So this is a flexible, removable denture. So there's a flexible one, there's also a rigid one. So flexible means it can bend a little bit, it can move somewhat, not move like out of your mouth, but it's more flexible than the other type. The other type is a rigid one. So this is a removable denture. It's worn inside your mouth and you have it, you can eat with it, you talk with it, you smile with it. They look like your teeth because we make sure that we match the shade of the teeth to the surrounding teeth, and then we also try and match the gingiva or the gum to the shade of your gum. In case you have pigmented gums, that means the gums are a bit dark on some areas, then we can make that to match your shade. So that's the first kind of replacement. That's the removable one. If you don't want something removable, you want something fixed. I hope you understand why I'm using the words fixed and removable. I'm trying to avoid the word permanent and temporary, because if we say we are putting a permanent replacement, that's a bit of it's a bit misleading. There's nothing permanent in this life. Even that tooth that you had removed, it was created by God and it was meant to be permanent, but look what happened, it came out. So there's nothing permanent in this life. So we'll use the word fixed instead of permanent, and we'll use the word removable instead of temporary. Yeah? So now your tooth has been taken out and you need it replaced. So this is one type of replacement, the fixed replacement I've been telling you about, called the implant. So the implant is a screw type kind of device that's placed inside your bone. So it mimics how your roots are. So it locks into the bone and the bone forms around it to make sure that it sits properly into the bone. So once you have this implant secured inside your bone, then the crown can be put on top. So this is the most secure kind of replacement that can be put in your mouth. There are some people who we cannot place an implant for. So people who have pre-existing gum and bone disease, severe gum and bone disease, because it only sits inside healthy bone. If the bone is not healthy, then it will not survive. There are people who are severe, what do you call this? These guys who grind their teeth like severely. So they size their teeth to the point of nothingness. So for such people, again, it's also difficult to put something like this, because it would mean that we can precipitate a fracture of the bone because of how they grind their teeth when they are not eating food, because that happens a lot when they are not eating. So for the implant, I just wanted to do a small demonstration, because sometimes people tend to think, oh, this thing that sits inside the bone, it's going to be painful when you guys do it for me. Remember, every procedure that we do that will require this kind of penetration, we have to put local anesthetic, so we make you slightly numb. So this is what it would look like. This is a dummy. So I'm not using the actual, this is not someone's mouth, this is a block, as you can see. And the blue thing that you see here, that's the implant. This is an actual implant. This length is around 10 millimeters. And this is more or less what is used on many cases. So there's 10 millimeters, there's 8, there's 13, depending also on the company that your dentist is using. So I'll just do a quick demo just to show you how it locks in. So if this block is your jaw and now we are putting the replacement, this is how quick it goes. So it's really smooth. Like right now it's already moving. So it's really smooth, goes in, it's almost disappearing. And it's a quiet procedure. There's no noise, there's no beeping. And there we are. The implant is locked. So now you can't see it anymore. So if this was someone's mouth, then we would tell that this is like what? It's like 100% retention. It's gone in, there's good stability, and the patient is good to go. So implants are what I believe, if God were to come down and say, what would replace my tooth, like to almost an exact measure, I think he would say implants, but I don't know. I guess you'd have to ask him. But implants work really well. So this is also an example of an implant that we have actually done for a patient. So the implant was put in, and then now this is the, what we call the superstructure, which is now the crown that comes on top of the tooth. So it will look like that. Of course, here there'll be some gum covering, so you won't have this exposure. Yeah, so looks pretty good once you look at it in the mouth, and most of the time people don't even remember which tooth was an implant, which one was your normal tooth, because everything sits well. So the other type of fixed replacement, remember I told you this, the implant. The other type of fixed replacement is what we call crown and bridge. So for crown and bridge, what happens is the tooth that is missing, okay, so in this case, this central tooth is missing. And we have these teeth that are adjacent to the missing tooth. So for a bridge, it doesn't get support directly from the bone the way an implant does. For a bridge, it will get support from the neighboring teeth. So the tooth in front and the tooth behind. So what happens, we trim both teeth. So we trim the tooth behind, and then we trim the tooth in front, and we make sure that we are able to get the dimensions aligned. Then we prepare 3 crowns. So one for the tooth behind, one for the tooth in front, and one to connect the two. So that's why it's called a bridge. You can think about it like this. This is water, and then this is land and land. So the land is being the 2 pieces of land are being connected by the bridge. So that's what a bridge is essentially. So the bridge can be made of the same material as the crown can be done. So it can be made of metal, it can be made of porcelain, zirconium, porcelain fused to metal. It can be made with precious or semi-precious metal. Yeah, and it would look something like this. So it's a good replacement. However, in my opinion, I find it a bit destructive because these were initially healthy teeth. The neighboring teeth were healthy teeth, like these two. They were okay. You can see in this example, they don't have cavities or anything. But now we've gone in and maliciously ground the teeth, and we sacrifice sound tooth structure. This is very expensive. When it comes to biological waste, this is true wastage. So we destroy all this just to put this. This doesn't make sense. So for me, I really advocate for placement of implants. The only time we can do this at our practice is if at all the person is not a good candidate for an implant for whatever reason, and this is what would work best for them. The bridge will be cemented. That doesn't happen. And that thing has fallen before. That thing. Anyway, yeah, let's continue.